Welcome. This is Conversations with Black Doctors, brought to you by Austin Black Physicians Association, also known as ABPA. The mission of the Austin Black Physician Association is to improve health disparities within our community and to inspire and nurture the next generation of Black doctors. The purpose of these webinars is to bring health information to our community from trusted voices in the Austin area. We want everyone to have the knowledge to care for themselves in the best ways possible. If you're interested in learning more about or collaborating with ABPA, please visit austinbpa.com. That's austinbpa.com. And please feel free to share.
Thank you for joining us today. I'm Dr. Jeff Hutchinson, and joining us today is Dr. Michelle Bandy. Today's conversation is about how do you prepare before you come to your doctor's visit. It's not easy. A lot of people don't like coming to the doctor, but the conversation we're going to have today hopefully will give you a few tips, and you'll hear what we think is important about things that you can do before you come to see us. Dr. Bandy, would you please introduce yourself and tell our watchers who you are?
Okay, I'm Michelle Bandy. I'm a family practice and lifestyle medicine doctor. I am at APATA Medical Clinic in Chattanooga, Tennessee, and I take care of conception to completion, from the babies to those who are about to make their way out. So, and our job is to help you get better, get rid of the problem, and help you live your best life.
Outstanding. Well, I'm so glad you're here today. We're going to talk about things that we can do. What do you tell patients before they come to see you? Do you have any particular advice that you give people to prepare before they come to the doctor?
Well, what I tell my family when I can get to them or friends is one, bring your medications, bring the whole bag, even the supplements you're taking. Okay, because nothing is more frustrating when people come in and say, what medication do you take? Well, I take a blue pill. For what? I don't know, maybe for sugar. It's not that helpful for us. It's good for you to know, good for us and you to know what you're actually taking so we can adjust accordingly. One. Number two, why are you coming to see us? Did your wife make you come? Did you want a physical? Is something hurting? Write that down. And if you got a lot of issues, write them down. And then let the doctor know you have a few concerns, but that you're good with just covering a couple, but you just want to make sure you kind of get an idea of what your issues are. And they'll appreciate it versus just saying, I got all these issues.
Outstanding. Yeah, that's exactly right. But one other thing that I add, because I have a lot of teenagers, a lot of young adults, the camera is fantastic. If they take a picture of all their medicine, then they don't have to actually lug it around, and they can show me the picture of the medicine that they're taking. And that way they don't have to remember to bring it to the doctor and back. But that list of questions, I absolutely agree. Having a list of things that you want to make sure we talk about is really, really helpful. So that's great.
Oh yeah, definitely. Now the thing is, I have some older patients and they don't do the picture thing. So but yeah, I do have patients who definitely bring their picture. That's very helpful. Much lighter to carry.
Yes, but we do have to meet them exactly where they are, right? If they don't like technology, we have to let them be themselves.
Absolutely.
Good. So sometimes patients come in and at the end of the visit, they say what's really important to them. I've often had patients go through the whole visit and say, what I really want to talk about is this. And while that's can be frustrating for everybody because we're all on a clock, we all feel that pressure to get through visits, we are here for you as patients. We're here for our patients. Is there anything that you do in particular to help patients get to that important question or that important point early in the visit instead of near the end of the visit?
That's a good question. Okay. Well, oftentimes I take a little bit of time beginning of the visit to just get to know the patient a little bit. With the COVID thing, I just show my face really quickly. This is who I am. I'm here to help you, and understand this is a non-judgmental zone. And so what you share with me, I can actually help you with. So, and oftentimes they get to it pretty quick. They may not tell the nurse, but within a few minutes, they'll share what they're coming in for. But you have a few that say, oh, well, actually it's this. I'm like, oh, okay. Well, uh, I can deal with this part of it right now, but given if it's a large thing, the scope and a large issue needs to be addressed, I'm like, we'll do this much right now, but we'll have to probably schedule an appointment to actually dig deeper into this. But in the future, if you ever want to talk to us, please let me know as soon as you possibly can, because I'm adjusting my education based off what you're telling me. And you share with me what you need, and I can help you out. I'm your coach. I tell them all the time, consider me your coach. Okay, I'm helping you live your best life. So you tell me what you're looking for, and I'll try to help you get to that end goal.
That's great. I like the showing the face. I hadn't thought about that because with mask and COVID, all of us have been just very careful. But the idea of letting them see what I look like, I may add that to what I'm doing now, because I think it does make a difference, that connection. The other thing that I do sometimes to help get to what's important is I start with that very open-ended question. How can I help you today? Just give them a chance to talk about things. But ultimately, you're right. If at the end of the visit, they bring up an issue that's really, really big, I say the same thing. We're going to have to make another appointment and address this issue for you.
The thing is, actually, every time I open up, I do open up with, how can I help you? What brings you here? But sometimes it gets to that very tail end. And yeah, because the funny thing is, oftentimes what the nurses put in there is not what the patient actually wants. So that's why I start with, like you said, what brings you here today? How can I help you?
Yeah, exactly right. And that sometimes is related to patients feeling like they're being judged. I don't know about your patients, but I know a lot of my teenage patients, they hold back a little bit because they don't know if I'm going to judge them or not, because older people are always judging younger people. And it can be tough to break that wall down and get them to share some of the things that are bothering them. Do you have any other tips or tricks that help you make that connection?
I usually just joke with my patients sometimes. And I think once they see a smile, they realize that I'm genuine and I'm there to help. And most people tell me a lot of stuff. I mean, the kids as well, young people as well, they seem to be pretty open to sharing once they realize that I do tell them too. I actually tell them this is a non-judgmental zone. I'm here to help you. So what you share with me can help me get you better. So what can I do for you?
That's
And
great.
most of them do share.
That's fantastic. Yeah, and I will have to say too that I get a look of excitement, a look of appreciation when my Black patients see me. They see someone who looks like them, and I think that helps to break down barriers too.
Absolutely. Some actually come for that reason, because a lot of them have a fear of not being taken care of. I get that a lot. And they're one of their biggest fears. Like, I'm not being listened to. I feel safe. I've heard a number of even grown men tell me that across the spectrum of different nationalities. They go, I actually feel safe here. I'm like, interesting, safe. And that wouldn't have come across my mind with the patient, but I hear that quite often. But,
Yeah. Another thing that sometimes I hear in the Black community, and I've heard this growing up too, is you have to dress and look a certain way when you come into the doctor. And asking my older relatives, why do you feel that way? And it goes back to exactly what you said, that they want to be heard, they want to be taken seriously. Do you come across that still? Or my patients, again, the adolescents, they're dressing the way they want to dress. But I don't know if you're still seeing that in the community, people feeling like they have to dress and look a certain way when they come to the doctor.
I can't say I've heard that. People come any kind of way to see me.
That's
But
good.
it doesn't faze me. But I can see why they might feel a certain kind of way coming into a certain institution. But
Good. Well, I want to assure anyone who hears this and may have heard something similar or think that way, is that we're not judging anybody. We're not here. And just like you said, judgment-free zone. So that includes the way you look, the way you dress, all the way you speak. All those things don't mean anything, because we're here to help. We want to be your coach, like you said, and work with you to be your healthiest self. Good. Um, is there anything else that keeps you, what for your patients do you like seeing them bring to a visit besides medicine? Is there anything else that you strongly encourage them to do before they come to see you or while they're seeing you?
Have an open mind and a can-do attitude. Because people come in there and some people are feeling down, like they can't make any changes, and they are maybe caught in a depressed situation. But when they come to see me, my thought is that you're here to get help and I'm here to help you. So if you give me an inch, we'll move it along. Just give yourself some grace. And give yourself some grace. You know, we're trying to help you out. And so if you're open to making some change, we're there to help you. If you say, well, I'm here, but I'm not making any changes, you're like, okay, well, why are you here? Shall I monitor your situation or you want to get better? What do you want? So does that answer your question for you?
It does. It does. We like to give our patients what we call agency, the understanding that they're in charge, that we can't live their lives for them. We can't make the changes. We're here to help them along. The other thing that I like to ask patients and families to do is, bring someone that you trust, someone that can hear the message too. And because sometimes you get news that can be a little devastating, quite honestly. And the more often you hear it, and if you have someone else to bounce it off of, it can make it a little bit easier.
Oh, absolutely. Because sometimes you just don't hear it the first time when you hear bad news. And it's like, what they say? And I tell patients too all the time, like, listen, understand that 50% of what I tell you, you're going to forget by the time you hit the door. Mm-hmm. So take notes. Like I said, bring somebody. And and it's also great in the hospital too, because a lot of things that can be missed as well. To not have that advocate for you. So I think that's a great idea. Yeah.
Good. Now, sometimes patients don't have the option of seeing a doctor that looks like them, that acts the way that they think they should be treated. Do you have advice for family members, for friends, before they see someone different, if they can't see you? Things that they might be able to do to make their visit more productive, more helpful, more compassionate.
One, when the doctor comes in, smile. Okay. It helps for that physician to know that you're open to whatever's going on, because oftentimes physicians are running different places. They get in there when the patient's max, they have to wait 15 minutes, and that can be challenging for a physician. So sometimes just having a smile and being open to answering the doctor's questions, but also when the doctor says, how are you doing? And if you're not feeling good, don't say I'm fine. Say how you really feel. Because when someone says, I'm fine, doctor, okay, well, they start moving their thing, okay, making, in their mind, they're moving on to the next step. But if something is actually bothering you, say, I'm feeling well today, however, or, it's been a rough day, or this is what, here's my concern, or something to that effect. To let them know that you're engaging them and you're answering truthfully, and they don't kind of just move on past. And if you don't understand something with the doctor, ask the doctor to explain it, because I think that is an issue as well. Because I have patients who often come to me, they've seen the specialist, they've seen the doctors, and they say, I saw them, I don't know what they were talking about. Can you explain it to me? And so I'm having to have people ship off and get records in so I can review the records to explain to the patient. And so it's helpful for the patient to tell the doctor, listen, I can you explain a little more simply to me so I can understand what's actually going on?
That's fantastic. That's great advice. And I think that's really important that we try to communicate. And one of the downsides of this last year during the pandemic, telemedicine takes away some of that nonverbal communication that we get when we're face to face. When people are shifting or not making eye contact because we're not explaining it well enough. That's why I like that face to face. And I like your idea about taking the mask off for a second too, because every little expression means something when we're paying attention. And other things that I tell families and friends who go see other doctors is exactly what you said. Ask the question until you understand. It's never your fault for not understanding, because we as doctors, we speak to other doctors, we speak medical speak all the time. And sometimes we forget that you don't have the same, that families don't have the same vocabulary that we do. They don't have the same background knowledge. And it is okay to ask your doctor, can you explain that to me again? I learned that from my wife. When I tell her something and she doesn't understand, she says, okay, explain it to me a different way. And that makes me stop and think, how am I explaining it? Can I do better? And I think we as doctors who want to do better, we appreciate you asking if you don't understand.
Oh, definitely. Definitely.
Good. Well, as we start to wrap this up, do you have any last words of advice, any last statements you want to say to the people who might be watching this?
Okay. I would say number one, your health is your responsibility. Okay. So that means it's your responsibility to get the help you need. Okay. And if you at some point in time feel that you're not getting what you need somewhere else, it's okay to get a second opinion. If a patient tells me, well, I want to ask somebody else, feel free. Please, I need to be comfortable with whatever we're doing in this process. Okay. Because it's your body. And if something is still bothering you and you feel like you're not being heard, again, make sure you can take it to whoever you need to get it dealt with, because different eyes, multiple eyes can sometimes make the difference in your life and outcome. Ask the questions, be open, and sometimes people treat you how you present yourself, however that is, subconsciously. So just go into it, open mind, and tell them what you need. And then they'll say, what can I do for you? And they'll take it from there. And realize we're there to help you out. We're coaches. And what makes Mibs excited, myself included, is when a patient says, this is the best I've ever felt in my life. I'm like, yes, we did it. Okay. So that makes it enjoyable for us as physicians as we go through this life, to see you getting better. So you getting better makes us feel good. So you do your part, we'll do our part, and hopefully we can get to the finish line together.
Those are great words of advice. And I would just add on to that, before you go to your visit, just like you were preparing for anything else, you have to think about why you're coming to see us. And if you write at least one or two questions down or points down that you want to make sure that we address, it makes it go so much better. You know, you don't leave thinking that we didn't address what you're worried about. And we know that you have told us what you really want to get addressed. So think about writing your questions down. Think about bringing somebody else. Think about talking to someone even before you come in to say, this is what I think should happen at the visit, because we are here to help you. So Dr. Bandy, I want to thank you so much for your time. It was fantastic talking with you today. And I want to thank everyone in the audience who listened, wherever you are. ABPA wants to continue to further its mission to improve health disparities within our community and inspire and nurture the next generation of Black doctors. If you're interested in collaborating with Austin Black Physician Association, go to our website at austinbpa.com. We'd love to hear from you. Thanks.